Hello, I am Linda Sarna, Dean of the UCLA School of Nursing. Before we begin today's pre-recorded ceremony, I want to acknowledge the very painful events of the past 2 weeks that have highlighted the discrimination, health disparities, and health inequities present in our communities, especially among people of color. Many ask, what can I do? As nurses, as the most admired professionals, you have the opportunity and the responsibility to take action and use your voice, to change the system and to reduce these disparities. Be inspired today by the words of Dr. Alicia Georges, our keynote speaker, who will provide guidance about how you and we can make a difference. Now, let the ceremony begin. Welcome to the candidates for the doctoral degrees, PhD and DNP, class of 2020. We will start with the Star-Spangled Banner performed by Jessica Hange, acute care nurse practitioner.
Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight, o'er the ramparts we watched, were so gallantly streaming, and the rockets regular, the balls bursting in air, gave proof through the night that our flag was still there. Oh, say, does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
Hello, everyone. I'm Linda Sarna, and I have the honor and privilege to serve as Dean for the UCLA School of Nursing. Welcome to our 2020 commencement ceremonies. Commencement is the highlight of the academic year, honoring and symbolizing academic success and personal achievement for each of you graduating today. It's a collective opportunity for faculty, families, and friends to celebrate this milestone. Some of you will be entering the profession as new nurses. Others will now be recognized as advanced practice nurses, and some of you will become nurse leaders and scientists. All of you are heroes in my book. I know we had all hoped to be together in Royce Hall today, and I share your disappointment that we are not. No one could have predicted that we would be in the midst of a pandemic, where we would not be able to gather in a way that allows us to remain at a safe distance from one another. However, we will do our very best to celebrate the accomplishments of your class during 2020, the year designated by the World Health Organization as the Year of the Nurse and Midwife. We're living in unmanageable times for society and for nursing education. You should take pride knowing that your accomplishments and your achievements will become stuff of legend. You graduated during the pandemic. The class of 2020 also will have a special place in our heart, and you will be commemorated as part of the history of the School of Nursing. You have displayed great courage and have made many sacrifices to continue your education. What our current situation hasn't changed is what you've learned and the pride we feel in seeing what you have overcome to get there. You make us proud. Over the 70 years of the School of Nursing, we have educated thousands of nurses who have addressed and are addressing the health and healthcare needs of the diverse populations of Los Angeles, of California, the nation, and the world. We have strived for academic excellence and led in the advancement of scholarship and research. Our graduates have provided quality care to many, especially those in greatest need. In this day, in this time, society needs you more than ever. COVID-19 has not changed the dream you had when you started to become the best nurse possible, to become the best advanced practice nurse, or to become the best nurse leader or researcher. If anything, I hope that it has solidified your commitment. So wherever you go and whatever path you choose, I know you will make the world a better place. I hope to see many of you again as you pursue your graduate education at the School of Nursing. I am pleased now to introduce our keynote speaker, Dr. Catherine Alicia Georges, who is the National Volunteer President for AARP, the nation's largest nonprofit, nonpartisan organization dedicated to empowering Americans 50 and older to choose how they live as they age. In this role, Dr. Georges is the principal volunteer spokesman for AARP and a liaison between the board and those AARP serves. In addition to her duties representing AARP, Dr. Georges is a professor and chair of the Department of Nursing at Lehman College of the City University of New York and a volunteer president of the National Black Nurses Foundation. She is a fellow of the American Academy of Nursing. She is actually a living legend of the American Academy of Nursing. She's also a member of the New York Academy of Medicine. She's a lifetime member of the National Black Nurses Association and Alpha Kappa Alpha sorority. She earned her undergraduate degree from the Seton Hall University College of Nursing, her MA in nursing from New York University, and a doctoral degree in educational leadership and policy studies at the University of Vermont. Welcome, Dr. Georges.
Dean Linda Sarna, faculty, staff, family members of the graduates, and most of all, to the class of 2020. Good morning. Congratulations to all the graduates on your wonderful accomplishment. I am honored to have been asked to be your speaker in this, the International Year of the Nurse and Midwife, but also a year where we are experiencing a global event never seen before, the COVID-19 pandemic. But I say to you, do not be daunted because we are faced with this disease. You have chosen a profession where you will touch people's lives in such a profoundly positive way because of your excellent preparation. You will be a critical part of a healthcare field undergoing considerable change because of this pandemic and the effects of the economic downturn in our country. I can't tell you exactly how this will shake out in the next 10 years or even in the next year or two. But I think there are some fundamental truths that we can be confident about that will shape your work and the future of healthcare. One is demographic, Another is the influence of social determinants of health. And a third fundamental truth is the critical role of nurses, a role that I deeply believe has and will become increasingly important. Let's start with a demographic change. 10,000 people in this country turn 65 every day. By the year 2030, 1 in 5 Americans will be 65 years or older. By that time, we might have 1 million people age 100 or older. Our fastest growing age group in this country are those over 85. People want to age with dignity and purpose, and the overwhelming majority of them want to age at home. As we reflect on longer lifespans, we need to focus intensely on longer health spans, later years in which we are in relatively good health, able to keep working if we want to, and able to enjoy the gift of time. Many older people are having the time of their life. Many more could be. How we have managed the pandemic and its effect on the older populations are lessons learned for the future. We have to recognize and address glaring health disparities driven by long-standing social dominance that exist across ethnic, racial, socioeconomic, and geographic lines, often in defiance of most promising trends in the population as a whole. The COVID-19 brought this once again to the surface. Social determinants of health, which include areas such as homelessness, poverty, food insecurity, education, and social isolation, have once again intersected in this pandemic. Yes, it's vital to eat a healthy diet, exercise, maintain strong social bonds, but how do you take a walk after dinner or visit with a friend if you're scared? How do you feed your family if you live in a food desert? How do you take your prescribed medications if you can't afford them? How do you stay socially engaged if you're stuck at home because your friends have died or your family has moved away? We are all experiencing what so many have tried to cope with in the past. It's called social isolation. We're aware of the effects of social isolation, which can be more impactful than cigarette smoking. We've made very meaningful progress in healthcare through the passage of the Affordable Care Act. And it's now almost universally acceptable that people should be covered for pre-existing conditions. Now we need to build on that progress by making sure that social determinants of health are a central part of the debate and discussions about improving healthcare. As skilled listeners and trusted professionals, nurses are adept at addressing critical questions concerning these social determinants. Questions like, are the needs for nutrition and long-term services being met? Is a patient or family isolated or depressed? Are there family dynamics that have a negative impact on this patient's health? Why is the patient missing medical appointments? Is the sky-high cost of prescription drugs forcing the patient to choose between paying for prescription drugs or buying groceries, paying rent, or utilities? You will have a vital role in making sure we acknowledge and address social determinants. You will be critical to meeting the healthcare challenges of all populations as we provide transitional care, help to reduce rehospitalizations, inform and support America's 40 million family caregivers, and provide care coordination, chronic disease management, and preventive care. The central contributions nurses make will only grow as healthcare is increasingly provided in non-traditional settings. As I think about the many key contributions you can make as nurses, I also believe that one of them is resisting the biases that can creep into our healthcare system. In many parts of our country, your zip code becomes the manner in which you are treated, or as called healthcare disparity by location. Making automatic assumptions about patients is a barrier to providing good healthcare. The scope of your contribution will reflect your capacity for recognizing the individuality of every patient and truly listening. Listening, in my view, is the most underappreciated skill, and it is a skill that we refine through practice. Nurses are skilled listeners, and that's one reason nurses are well positioned to be leaders. Think of the many assets nurses bring to a leadership role. Technical knowledge through your studies and your practice. Trust. For over 17 years, the Gallup poll has found nursing to be the most trusted profession. The ability to keep a clear head under pressure, understanding the principles and the value of teamwork, the capacity to provide comprehensible, jargon-free explanation, and a close-up view and insights into the problems your patients face. As you think today about your new degree and where you're headed next, I'll ask you to consider for a moment where you will be in a few years and the skills and the experience you will have gained and how you can put those assets to work in different arenas. I urge you in your careers to share your perspective, to look for opportunities for leadership, to find a place at the table where policies are set. No seats, bring your own chair. I urge you to use your voice. Nurses are pivotal to building a culture of health in our country, a culture that embraces prevention as well as treatment, a culture that seeks to shed biases, a culture that meets head-on the external factors that produce such inequitable outcomes. To truly exercise that pivotal role, you must use your voice. Our communities and our country need to hear the voices of nurse leaders, not only in the hospital room, but in the boardroom, in the committee room, in the legislative chambers, where budget and policy decisions are made. We need to hear the voices of nurses on the social determinants of health. Maybe someday you'll even take on an entrepreneurial role, pulling together a business with other nurses. After all, the portended consolidations and other structural changes that are inevitable during and after this pandemic will create new models in healthcare delivery. That will affect nurses as well as hospitals and doctors. You can shape what they should be. Being resilient and having a sense of humor about life and yourself are indispensable. Taking on a leadership role can be daunting, but probably easier than the challenges you've already conquered, like taking courses at UCLA. Use your knowledge and use your voice as we seek to create a culture of health. Your patients, your community, and your country need you. When more and more nurses speak up, we will set in motion an unstoppable wave of change. Your influence in private settings and in public policy will reinforce each other. With this degree in hand, you are setting your direction by a moral compass. I want to leave you with some words from a poem that I use called Life. It goes like this. It says, find a passion and pursue it. Fall in love. Dream big. Spend quality time with family and friends. Laugh every day. Believe in magic. Tell stories. Reminisce about the good old days, but look with optimism to the future. When possible, travel often. Learn more. Be creative. Never give up. Do what you love, but be true to who you are. Make time to enjoy the simple things in life. Forgive even when it's hard. Smile often, but be grateful. Be the change you wish to see in the world. Try new things. Work hard. Don't count the minutes, count the laughs. Remember to embrace change. Trust in yourself. Be thankful. Be nice to everyone. Be happy. Live for today. And above all, make every moment count. Thanks for inviting me.
Thank you, Dr. Georges, for that inspiring keynote. We will be conferring 2 doctoral degrees today. The first we will present is the Doctor of Philosophy. The PhD program is the culmination of several years of rigorous studies. The PhD program provides the theoretical and scientific foundation for nursing care and focuses on the development of new knowledge related to nursing practice, health, and healthcare. In order to receive a PhD, students must complete an original dissertation that advances science. These are the nurse scientists of the future. Selected to speak on behalf of the PhD candidates is Felipe Guiterrez.
Greetings to all, especially Chancellor Jean Block, Provost Emily Carter, our distinguished Dean, Dr. Linda Sarna, dedicated faculty, family, friends, and of course, the class of 2020. Congratulations in this year of the nurse. I am honored to speak to you today, and I'd like to share a few thoughts as we embark on the next phase of our lives. Guided by the Nightingale light, we have reached the shores that few of us believed we could. This voyage has brought us to the crest of a new horizon, a horizon of limitless possibilities and adventures yet unseen. So what is next? Now is the time to start using the tools we have gained to make the difference we know we can. Do not be happy to just settle in. Be ready to experience, together with the strength of UCLA Bruins, the challenges stretched out before us. Our studies have given us a wealth of information, unique to each of our individual disciplines, yet all equally important. With this, we are now challenged to transform these lessons into something good for the well-being of humankind. How we share these new gifts will be seen in our contributions to the nursing profession and to the impact we bring to the patients we serve. So how will you make a difference? To that I say, go out into the communities you serve and improve the lives of those who depend on your talents. I believe in us and know you do too. Together we have touched the lives of persons with asthma, pressure injuries, alcohol use disorder, breast cancer, and post-traumatic stress disorder. We have reached our destination and flourished along the way. We have obtained the knowledge, we have gained the skills, we have proven our resilience, and we have displayed the drive and passion needed to make change occur. Wisdom is powerful. We have persevered. We can be confident that we are the experts in our fields. We now believe the impossible is possible. We know this because we have sailed through the previously impassable channels. Fear of failure is no longer in our vocabulary. Our futures are full of endless opportunities, continued learning, and history in the making. We all know the demanding journey we took to get here today. And yes, we made it. Be fearless and believe there is nothing you cannot do. Robert F. Kennedy said, "Few will have the greatness to bend history itself, but each of us can work to change a small portion of events. And in the total of these acts will be written the history of this generation." Let each of us start working on our small portion of events, and together, the class of 2020 will be a positive part of this generation's history. Fiat lux, let there be light. Thank you once again for this opportunity. Florence would be proud of us all.
Hi, I'm Dr. Barbara Bates Jensen. It's my pleasure to present the 2020 candidates for the Doctor of Philosophy degree. I will state each candidate's name, any honors or awards, the title of their dissertation, and the chair of their dissertation committee. Sherry Bantad Anzaldo, Sigma Theta Tau, the 2020 Dissertation Award. Filipino-American Parental Beliefs and Perceptions About Managing Care for Children and Adults with Autism Spectrum Disorder. Chair, Dr. Felicia Hodge. Joanne Marie Fierro, Sigma Theta Tau, Alpha Tau Delta. Adherence to National Asthma Education and Prevention Program guidelines in the Medi-Cal population before and after the implementation of the asthma registry into the electronic medical record at Chalk Children's Hospital. Chairs, Dr. Wendy Robbins and Dr. Marianne Lewis. Felipe Guiterrez. Preliminary efficacy of a nurse-led brief intervention quasi-experimental pilot study for individuals presenting to the emergency department with risk for alcohol use disorder. Chair, Dr. Eunice Lee. Yalda Rahimi Hashimi. Ethnography of attitudes towards pressure injury prevention in critical care nurses, providers, and patients and families in intensive care units. Chair, Dr. Barbara Bates Jensen. Melissa Diane Scalia, Sigma Theta Tau. Sexuality and femininity in older women after the diagnosis of early-stage breast cancer. Chair, Dr. Highbury Peters.
Will the candidates for the Doctor of Philosophy degree please rise? By the powers vested in me by the Regents of the University of California, I bestow upon you the Doctor of Philosophy degree and all the rights and privileges thereof. Congratulations, doctors. The Doctor of Nursing Practice degree prepares nurses to change healthcare and healthcare policy. The curriculum for the DNP builds upon the advanced practice nursing education, including nurse practitioners, clinical nurse specialists, and nurse executives. In order to receive a DNP, they must complete a scholarly project that will translate evidence into practice to improve patient outcomes and population health. These are the nurse leaders of the future. This is our very first DNP cohort. Representing the DNP program is Erin Kopp.
Good morning. I'd like to start by offering my sincere thank you to everyone for joining in this most unique commencement in these most unique times. Although we may not have pictured celebrating remotely, let's take a moment and be mindful that we are blessed to share today with each other. We are here to honor the inaugural Doctorate of Nursing Practice class at UCLA. It's a class of firsts, a class of pathfinders, and a class of pioneers. 2 years ago, 15 individuals entered this program and perhaps unwittingly signed up for a crash course in problem solving, flexibility, and survival. We chose to dive in and to face whatever wave came our way. And maybe we didn't expect a tsunami, but we made the commitment to face it and to overcome any obstacle. Our journey began in a relatively normal fashion. Like any student, we had the myriad of emotions. We were excited about opportunities to come, had trepidation surrounding the logistics of achieving goals and the high standards that we had for ourselves and set by our faculty, the inevitable sacrifices that our family and friends would make to support us through this, and of course the question we all ask ourselves, what did I get myself into? But we decided to join Dr. Bush, Dr. Cardin, and Dean Sarna in the creation of this fledgling program because we believed in it. So we were there. And we were excited, but we needed to know what exactly were we working towards? What is a DNP? Well, luckily, we were introduced to the 8 essentials of being a DNP and the infamous elevator speech to explain it to others. Just picture a Cliff's Notes version to serve as a summation of all of our academic achievements in 30 seconds or less. But it gave us the chance to answer, what is the difference between a PhD and a DNP? What will you do with this degree? And is it worth it? Well, today I have the opportunity to share my final elevator speech as a student, to answer those questions for our class and the classes of tomorrow. A DNP prepared nurse has achieved the terminal clinical degree in nursing. Through the application of evidence, the DNP translates science into practice to improve patient outcomes, to change systems thinking, and to change the health of populations. We are advocates for everyone, from the bedside all the way to the White House. We collaborate with other disciplines to improve the health for all. Through our practice and through our scholarship, we lead by example to empower others to join us in creating a world where health is no longer a privilege, but it is a right. So we are here, and we are the embodiment of the UCLA DNP program. Through everything we faced, we found courage by looking into each other's wisdom, knowledge, experience, and compassion. Bonds were forged between us that not only propelled this group through the program, but also created a village of our chosen family. We became each other's people. The synergy of the beauty and the strength combined to turn the 15 individuals into the one, the class of 2020. As a group, we showed up. Through massive fires, illness, loss, and trauma, we showed up. And without realizing it, every time we had the choice to give up or forge ahead, we dug into our collective soul and we put one foot in front of the other to move toward today. No one was left behind. Through this process, we were unknowingly building the resilience we will need to embody all of the facets of what a DNP should be. Ironically, we were put to the ultimate test facing an unprecedented pandemic in our final quarter. Not sure which of the faculty planned this clinical exercise, but I'd like to say we are all ready for it to be over. But in all seriousness, as one of my wise colleagues stated, we became DNPs for a time like this. We joined together. We pooled our strengths and lifted each other up to conquer the insurmountable. We asked to be the first, and we crushed it. I want to thank everyone, our family, our friends, our colleagues. May we shine brightly and change the world, the one and only first DNP class of UCLA 2020.
Hello, my name is Nancy Jo Bush, and I am the director of the Doctor of Nursing Practice program. I am honored and proud to introduce our inaugural cohort of graduates. I will read the titles of their DNP scholarly projects, then introduce the project chair. Melanie Altamirano, Sigma Theta Tau, the role of empowerment among a code stroke team and its effect on code stroke outcomes. Dr. Wendy Robbins, Chair. Annabelle Braun, Target Stroke, Best Practice of Direct Transport to Computed Tomography and its Impact on Stroke Treatment Times. Dr. Joanne Eastwood, Chair. Jerome Mendoza Deo, Sigma Theta Tau, a standardized web-based leadership development for new nurse managers in a tertiary public safety net academic medical center. Dr. Lynn Doring, Chair. Nazrin Esnajari, Sigma Theta Tau, Alpha Tau Delta, Deep Brain Stimulation Education for Patients and Caregivers. Dr. Mary Lynn Brecht, Chair. Yushin Michelle Fang, Sigma Theta Tau, Improving Goals of Conversations with High-Risk Heart Failure Patients. Dr. Barbara Bates Jensen, Chair. Kamala Kentria Gibson McElroy, Sigma Theta Tau, Staying Focused, Provider Utilization of an Electronic Health Record DSM-5 Criteria Evaluation Tool for ADHD. Dr. Nancy A. Pike, Chair. Yvette Loretta Goodridge, Sigma Theta Tau, the use of complementary alternative medicine for pediatric headaches. Dr. Nancy A. Pike, Chair. Erin Allison Kopp, Sigma Theta Tau, burnout and increasing resiliency in a population of hematology nurses amid a pandemic crisis. Dr. Carol Pavlish, Chair. Anila Ladek, a nurse-led delirium prevention program for hospitalized older adults. Dr. Jan Mentis, Chair. Rosemarie Lara, an enhanced communication medication intervention from the hospital to the skilled nursing facility. Dr. Mary Cadigan and Dr. Jan Mentis, co-chairs. Cheryl Ohuke, Sigma Theta Tau, telemetry, less is more. Application of practice standards to ECG monitoring in surgical patients. Dr. Lynn Doring, Chair. Maria Felicia Hidalgo Marcus, the impact of early initiation of exercise on acute low back pain and disability. Dr. Marianne Shinnick and Dr. Mary Wu, co-chairs. Angel Lionel Moreno, building a structured field within the progress note in migraine documentation, a Doctor of Nursing Practice Quality Improvement Project. Dr. Wendy Robbins, Chair. James Quincy Simmons, Sigma Theta Tau, the Insta Prep Project, a social marketing intervention on Instagram to increase oral HIV prophylaxis in Black men who have sex with men. Dr. Dottie Wiley, Chair. Michelle Carolyn Tolentino, Sigma Theta Tau, improving span of support designed to influence nurse perception of leader access and responsiveness. Dr. Felice Shange Hodge, Chair.
Will the candidates for the Doctor of Nursing Practice degree please rise? By the powers vested in me by the Regents of the University of California, I bestow upon you the Doctor of Nursing Practice degree and all the rights and privileges thereof. Congratulations, doctors.
In full knowledge of the obligations I am undertaking, I promise to care for the sick with all the skill and understanding I possess.
Without regard to race, creed, color, politics, or social status, sparing no effort to conserve life, to alleviate suffering, and to promote health.
I will respect at all times the dignity and religious beliefs of the patients under my care, holding in confidence all personal information entrusted to me, and refrain from any action which might endanger life or health.
I will endeavor to keep my professional knowledge and skill at the highest level, and to give loyal support and cooperation to all members of the health team.
I will do my utmost to honor the International Code of Ethics applied to nursing and to uphold the integrity of the professional nurse.
I want to take a moment to say thank you to the faculty and staff who worked so hard to produce this, our very first virtual commencement. Doctors Barbara Bates Jensen and Nancy Jo Bush read the student names. Shelley Shepard, Janet Kang, Stephanie Dominic, and Sue Kwong provided support from student affairs, and Laura Perry did a stellar job from communications. Thank you. But now I want to recognize all of you who have helped these graduates achieve their goals. Thank you to the spouses and significant others. Thank you to the parents and the grandparents. Thank you to the children. And thank you to the other relatives and friends watching today. Thank you all. Thank you so much for joining us today, and best wishes to the new degree holders.